How many of us pro choice people couldn't see this coming? If you are a woman or a girl of childbearing age and you're living in one of these forced birther states, your health is definitely at risk because they don't care about grape or incest or anything. They don't care about the medical conditions of the woman or girl until her health is just about gone. They don't care if the fetus is non-viable. They don't care in these forced birther states. Now, this news has been reported in different outlets. This one happens to be The Guardian. Rise in pregnant women turned away from U.S. emergency room. Paper show. Now, the crazy thing is, many OBGYNs and other medical professionals are fleeing these Christo-fascist forced birther states. So even women who wanted these pregnancies are going to be harmed. Okay, let's get into the article. One woman miscarried in the restroom lobby of a Texas emergency room as front desk staff refused to admit her to the hospital. Now remember, Brittany Watts was prosecuted harshly in Ohio because she miscarried in the bathroom. But these people in this pro-life state, aka the forced birther state, that supposedly love unborn babies, couldn't even help this woman that was in need. Another woman learned that her fetus had no heartbeat at a Florida hospital the day after a security guard turned her away from the facility. And in North Carolina, a woman gave birth in a car after an emergency room couldn't offer her an ultrasound, and the baby later died. Complaints that pregnant women were turned away from U.S. emergency rooms spiked in 2022 after the U.S. Supreme Court overturned Roe v. Wade, the federal documents obtained by the AP reveal. The cases raise alarms about the state of emergency pregnancy care, especially in the forced birthers states, and sparked confusion around the treatments doctors can legally provide. It is shocking, it's absolutely shocking, said Amelia Huntsberger, an OBGYN in Oregon. It's appalling that someone who would show up to the emergency room does not receive the care. This is inconceivable. It is totally conceivable. We could conceive this. We knew that women were going to be harmed, even women that wanted these pregnancies. And it has happened despite federal mandates that the women be treated. Federal law requires emergency rooms to treat or stabilize patients who are in active labor and provide a medical transfer to another hospital if they don't have the staff or resources to treat them. Medical facilities must comply with the law if they accept funding from the federal government Medicare program. The Supreme Court will hear arguments next Wednesday that could weaken those protections. The Biden administration has sued Idaho over its abortion ban, even in medical emergencies, arguing that it conflicts with the federal law. If you haven't heard, in Idaho, I believe, they don't have to help pregnant women if they are having a medical emergency. They could just say, get someone else to do it. These forced birther states simply are saying to women loud and clear, we don't give an F about you. But the women in these forced birther states are not voting them out, and I do not understand it. No woman should be denied the care she needs, Jennifer Klein, director of the White House Gender Policy Council, said in a statement. All patients, including women who are experiencing pregnancy-related emergencies, should have access to emergency medical care required under the Emergency Medical Treatment and Labor Act. Pregnant patients have become radioactive to emergency departments in states with extreme abortion restrictions, said Sarah Rosenbaum, a George Washington University health law and policy professor, adding, they are so scared of a pregnant woman that the emergency medicine staff won't even look. They just want these people gone. They just want these women gone. And some women are literally expiring because of this. A woman who was 9 months pregnant and having contractions arrived at the Falls County Hospital in Marlin, Texas in July 2022, a week after the Supreme Court's ruling on abortion. The doctor on duty refused to see her. The physician came to the triage desk and told the patient that we did not have the obstetrics services or capabilities, hospital staff told the federal investigators during interviews, according to documents. The nursing staff informed the physician that we could test her for the presence of amniotic fluid. However, the physician adamantly recommended the patient drive to a Waco hospital. Investigators with the Centers for Medicare and Medicaid Services federal agency concluded that the Falls Community Hospital broke the law. Reached by phone, an administrator at the hospital declined to comment on the incident. The investigation was one of dozens the AP obtained from the Freedom of Information Act request filed in February 2023 that sought all pregnancy-related EMTALA complaints the previous year, and 1 year later received limited results from just 19 states. Federal investigators looked into just over a dozen pregnancy-related complaints in those states in the run-up to the Roe ruling, but more than 24 complaints in the months following. It is not known how many complaints were filed last year, as the records request only asked for 2022 complaints, and the information is not publicly available otherwise. The documents did not detail what happened to the patient turned away from the Falls Community Hospital. Other pregnancies ended in catastrophe, the documents show. At Sacred Heart Emergency Center in Houston, front desk staff refused to check in one woman after her husband asked for help delivering her baby that September. She miscarried in a restroom toilet in the emergency room lobby while her husband called 911 for help. She is bleeding a lot and had a miscarriage, the husband told the first responders in this call, which was transcribed from Spanish in federal documents. I'm here at the hospital, but they told us they can't help us because we are not their client. Emergency crews who arrived 20 minutes later and transferred the woman to a hospital appeared confused over the staff's refusal to help the woman, according to the 911 calls. One first responder told federal investigators that when a Sacred Heart Emergency Center staffer was asked about the gestational age of the fetus, the staffer replied, "No, we can't tell you. She is not our patient. That's why you are here." A manager for Sacred Heart Emergency Center declined to comment. The facility is licensed in Texas as a freestanding emergency room, which means it is not physically connected to a hospital. State law requires those facilities to treat or stabilize patients. A spokeswoman for the Texas Health and Human Services Agency said in an email, Sacred Heart's emergency website says that it no longer accepts Medicare, a change that was made sometime after the woman miscarried, according to publicly available archives of the center's website. Meanwhile, the staff at Person Memorial Hospital in Roxborough, North Carolina, told a pregnant woman who was complaining of stomach pain that they would not be able to provide her with an ultrasound. The staff failed to tell her how risky it could be for her to depart without being stabilized, according to federal investigators. While en route to another hospital 45 minutes away, the woman gave birth in a car to a baby who did not survive. Person Memorial Hospital self-reported the incident. A spokeswoman said the hospital continued to provide ongoing education for our staff and providers to ensure compliance. In Melbourne, Florida, a security guard at Holmes Regional Medical Center refused to let a pregnant woman into the triage area because she had brought a child with her. When the patient came back the next day, medical staff said they were unable to locate a fetal heartbeat. The center declined to comment on the case. Emergency rooms are subject to hefty fines when they turn away patients, fail to stabilize them, or transfer them to another hospital for treatment. Violations could also put hospitals' Medicare funding at risk, but it is unclear what fines might be imposed on more than a dozen hospitals that the Biden administration says failed to properly treat pregnant women in 2022. It can take years for fines to be leveled in these cases. Understand that women's health is under attack. So many people act like, they just care for the babies. They just care for the babies. But when women attached to these babies die, what happens? What happens? These people can no longer have babies when they are harmed like this. Anyways, jump in the comments. Let me know what you think about this. Don't forget to like, comment, and share. Lots of these industries are in their find out season. They are just not treating the employees well. And we've seen that the medical community is in flux. The pandemic kind of highlighted, it kind of severely broke what was already in triage. Yes, I'm using some medical terminology. But what we're seeing now, what we saw last year with a bunch of nurses going on strike, is that things are completely jacked up, and patient times are getting way longer. Patient loads for nurses, that's what they were talking about last year. Patient loads are way too high for the staff, and they are running the staff into the ground. Y'all have got to recognize how this is going to impact everyone. You literally cannot get sick. You literally don't have the opportunity to have an emergency, because you never know what the wait times are going to be like. You got to take control of your health. You got to make sure you're driving for everybody, including yourself. Because if you go to the emergency room, depending on, are you in a rural state? Are you in a place that has way too many people for the staffing levels? You've got to understand that it could be life or death. Breaking your arm used to just be setting your arm. But what if you break your arm and can't get it set? If you can't stop the bleeding somewhere because the staffing is jacked up. So pay attention to these places where the medical staff are grumbling, because they're grumbling for a reason. If they start grumbling to where the public sees it, they have probably grumbled to their higher ups way before that. Okay, so this one is out of Detroit. Contracted doctors, physician assistants at Ascension St. John go on strike. Contracted physicians and physicians assistants at Ascension St. John Emergency Department kicked off a 24-hour strike Thursday afternoon amid demands for better staffing and work conditions. So if you're in that area, please don't have an emergency. It's going to be a terrible, terrible time to have an emergency. The strike comes after the union, the Greater Detroit Association of Emergency Physicians, threatened to take action last week after ongoing negotiations for their first ever contract with employer Team Health, a private Tennessee-based physician and hospital management company. The union represents contracted doctors, advanced practice clinicians, physician assistants, and nurse practitioners in the Ascension St. John's Emergency Department. Those hospital workers are not directly employed by the healthcare system. So keep in mind that these private funds are for profit. They are here to make money. They are not here to give an actual F about your health. And that is who is responsible for your health. But they're not worried about that. They're just trying to get the most bang for the buck. And they're treating their doctors, and these people are doctors, and they're treating them like this. So just know that the people that are on lower levels are getting treated way worse. So just pay attention to what's going on in the area. Here is the video that was embedded in the news article.
Save staffing! Save staffing! Save staffing! Save staffing! Save staffing! We are emergency physicians who started a union last year because we essentially got no response from the hospital or our employer when we told them that we had significant concerns about patient safety and the security and safety of our staff. We're short on security, we're short on nurses. We have 50 people in the waiting room, and so when we still tried to bargain and force them to the table and got nowhere after 7 months, we are now on a picket line, which is not where any of us thought we were going to be. The fight against the private equity and the corporatization of medicine. Physicians are waking up and realizing when they control the majority of the market, they can do whatever they want to, and that's putting us in a really bad position between the patients and our employers.
I came into work at 10 p.m. on Sunday, and someone checked in. I left my 8-hour shift. I came back at 10 p.m. on Monday, and that person was still waiting to be seen. And they were actually waiting. And this was their only source of recruiting. This was their only access to healthcare. That's a bad feeling, knowing that I want to help people, but I can't.
You know, it's affecting everybody's personal lives. It's affecting the way we work. Like, you can't have low morale and do this kind of job. It's something that it's already stressful enough. We're put in this environment where you never know what's coming at you. You're already running as fast as you can, and then you stack everything else on top of it, and it's just everybody is making it until their 40s and wanting to retire, looking to do Botox or something. We're losing a lot of good physicians.
Very much to hear what you think.
Fight